was born with a disability, and I used to crawl down throughout my childhood up to the age of 23 when I came in hospital with the support of CBM, and I was amputated. And after a certain period of time, it was like 3 months, I was brought to rehab to receive some prosthetic limbs to support my mobility. What I can say about this is I used to face challenges in rainy seasons because I could not put on shoes, and I would get some rashes and sometimes wounds due to the stone cuts, but these limbs raised me from the ground now, and these limbs, like, they expose me like quick to the, let me say, to the employability sector. Like by then I was really down and I was looked at as a child, but now since I'm raised, the employability sector is not hard for I to maneuver. And also my mobility, I would walk very slowly. Now a distance of where I would cover 30 minutes to walk, I can cover it in 10 minutes or 5 minutes. It was measured in December, preparing me to get these limbs, and it only took 2 weeks to be called back for the fitting, but due to the Christmas period, I was given more extra 2 weeks. So I came back in January to receive them. And it was real quick. 2 weeks, it's not much.
CoRSU receives 25,000 patients as OPD on an annual basis, and we conduct over 3,000 surgeries for both orthopedic and plastic surgeries. So because of that, we do that for free for almost 70% of the patients, because these are children from vulnerable communities that cannot afford surgery, let alone just transport to the hospital. Because of that, we are organizing a fundraising initiative called the CoRSU Annual Walk, and this is done annually. Last year we did it with support from MUBS. This year we are back. It's going to be at MUBS Makerere University Business School on 5th of October. And we request the entire community that this event is to raise awareness for children and people with disability. Your contribution can come through buying a kit. We are going to walk, not run, but those who want to run can run. So we are going to sell the kit at only 30,000. You can pick it from CoRSU Hospital, but also you can reach us through our website numbers, and we shall be in position to bring you the kit wherever you are.
Currently, Uganda has a shortage of assistive devices. We have less than 10 big rehabilitation centers, and CoRSU has the largest comprehensive rehabilitation center that offers orthotics, prosthetic devices. For a child who has lost a limb, for a child who cannot walk, these come in handy to help to aid with mobility, to even participate in other activities. We've seen a high rise in communicable diseases, accidents that lead to amputations, and fractures that require assistive devices. Traditionally, it takes us between 3 to 5 days to provide assistive devices with a traditional way. It also has a lot of waste because you have to do the negative cast, positive cast, before you can be able to provide this child with the desired assistive device. But with 3D technology, we are able to produce a number of devices in a clean environment for between 4 hours to 18 hours, according to the type of device. Let's say a child has lost both of their limbs. Most of the times, they are left locked up in a place, or they are not able to go and run, play, or participate in school. For other children that have undergone surgery, their rehabilitation is not done. Imagine investing 5 million in an assistive device only for a child not to walk properly because they don't have an assistive device. That's where 3D technology is here. We are targeting vulnerable children who would have not participated in their day-to-day life or left behind because they don't have assistive devices. With the 3D technology, we are going to be able to provide cost-friendly assistive devices to vulnerable children which are subsidized by the different donors that we have, to the most vulnerable child to be able to participate in their day-to-day life.
Government has embraced science and innovation, and health is beginning to walk the talk in the areas of innovation. CoRSU is leading the way for us in terms of innovating through 3D. Now, in this 3D arrangement, they're innovating in the spaces of orthosis, processes, and also trying to see if they can innovate white canes so that they are able to impact on people with the physical disability, but also with impairments like vision impairment, hearing impairment, and many other spaces and spectrum of disability. In this 3D, they have impacted lives of people who ideally would have failed to get mobility if they did not invest in trying to make processes which otherwise traditionally would take like a whole week in just less than 8 hours.
Been active with producing and printing prosthetics and also orthotics. It's very successful. We're doing that all under one roof here at CoRSU. The feedback from our clients and patients is good for the use of orthotics, insoles, ankle-foot orthoses, other orthoses and orthotics, but also for prosthetics. So we're making good steps forward, and my feeling is that we are about to be able to sustain that with help from different sides, partly client fees, insurance fees, and also donor funds. So I believe 3D technology is the future, but not totally. We should still keep our skills of orthopedic technologists to do the conventional technique, because that is two parallel approaches that we have to continue to do, otherwise we lose our skills.